Performing tabletop exercises is a good method for community stakeholders to get together and understand some of the shortcomings that may arise during the course of a disaster. One of the many things to remember is that being prepared will save lives. Whether you perform your tabletop exercise with community members and organizational staff or personnel, or if it is a full-scale exercise in dealing with those same community members, but also including the local, state, federal, or jurisdictional agencies to perform a full-scale exercise, any type of training will assist in minimizing the dangerous conditions and life safety issues that may arise. It is by no means an easy task to establish a full-scale exercise. It takes much time, planning, utilization of resources throughout the community in order to make the exercise happen, as well as funding and having the ability to perform a full-scale exercise, working alongside your community stakeholders. Working alongside your community stakeholders will provide a wealth of information, as well as having many resources that may be used during that full-scale exercise. On the other hand, the same community resources may be of use during the actual event once those resources are discovered during the practice of that full-scale exercise. But it is imperative to research and meet with these community resources prior to an event, and more importantly, train with them regarding the main types of natural and human-made disasters that may impact that local community. One of the main focal points for any full-scale exercise is actually performing the research, but also being able to communicate with the community stakeholders and leaders that will be most influential during the actual full-scale exercise. This is one meeting that will be held at least one time a month in order to get the full-scale exercise up and running. You'll need to define these communities as you go along, and also identify the community stakeholders as well as the groups that will be involved in order to facilitate all the planning efforts that need to be accomplished in such a short period of time. Normally it takes approximately 10 to 12 months to actually sit down, plan, and execute the full-scale exercise. Some of the research that needs to be done regarding the exercise includes reviewing some of the city plans, reviewing some of the previous disasters and emergencies that had taken place in that community over the past 5 years, and also review the local hazard vulnerability analysis. The HVA may be the key to unlocking some of the areas that need to be trained upon within the community, as well as it being redirected for research purposes regarding those hazards. Some of the key elements for making a full-scale exercise successful is creating a list of objectives that need to be met. These objectives will be the key foundation and key performance points within the full-scale exercise. That should not be taken too many objectives within this exercise, and should be written down so this way not to complicate the exercise and realistically meet those objectives and goals to make it tangible during the exercise itself. If those exercise goals and objectives are not met, several of the stakeholders may feel that the exercise is not complete, did not meet the realization of their needs, as well as prolonging an event that may have taken care of initially at the outset. Keep in mind these objectives must be concise and directly related to the event that is going to be trained upon. A good rule of thumb is to have approximately 5 objectives that will be listed and that will be tested and accomplished during the full-scale exercise. This not only shows that there is a coordinated effort, but also there is one final sight in mind concerning the exercise. One of the first things that needs to be accomplished in an exercise, aside from the objectives, is the ability to meet with the community stakeholders and plan out exactly what needs to be done regarding any types of personnel that may be used, locations, type of disaster that will be used, building upon the scenarios, any props that will be used, logistics, and perhaps publicizing within a local newspaper or radio station regarding the community performing a disaster event for emergency response. Also, it will be imperative to demonstrate what the costs incurred will be regarding the full-scale exercise. Oftentimes, there may be enough resources where grant funding can be used in order to perform a full-scale exercise. On the other hand, if grant monies are not available to perform the exercise, creativity and innovation may be needed to substitute for some of those areas that appear to be shortcomings regarding funding. Theatrical groups may also be used as patients if you're willing to perform a quality full-scale exercise demonstrating injuries, as well as using faith-based organizations for participating in the scenarios. Once the objectives have been established, the type of scenario, and the community stakeholders that are involved in the process, it's now time to develop exactly when the exercise is going to take place. The availability of all the resources within the community will depend on the time of year. If the exercise happens to be during the school year, the likelihood of having children or adolescents involved in the event may be impacted depending upon their availability. On the other hand, summer vacations and classes that are being let out for summer break will have a probable impact on the interest level in performing such a full-scale exercise during the summer months. A good full-size and full-scale exercise will involve your local, state, and federal agencies. This will also offer some of their input as well as provide solutions to what may take place in the event of an actual disaster. An example of a full-scale exercise that may be a contemporary issue is an active threat or active shooter, depending on the type of organization that you may be working alongside. You also have to take into consideration whether or not some of the resources in these areas will be made available to you in order to train for such an event. For example, an empty floor or vacant building may or may not be available in order for the perfect training opportunity to occur. Just remember, training alongside and educating along with other countless agencies and organizations obviously takes permission from marketing representation, risk management, and administration for the imperative success of the overall full-scale exercise. Working with law enforcement agencies, fire departments, EMS providers, as well as those within other hospitals in the surrounding area will also be critical for the success of the overall implementation of the exercise. It may take several weeks and perhaps years in some cases to actually facilitate such an exercise. On the other hand, being able to formulate and bring it out to the community representatives together on one setting within the local level at that community can be beneficial to all those stakeholders, public agencies, private organizations, as well as the organization internally who is actually putting on the exercise. Much planning will be needed in the advent of creating your full-scale exercise document. Your document will need to be comprehensive, as well as listing all the players, observers, and those who will be running the exercise itself. You will also need to include in the appendix a listing of all the acronyms in abbreviation forms that will be used during the course of the exercise. The scenario will always have to be mentioned during the context of the document in order to alert participants and have them have the idea of what the exercise will entail, as well as any changes that may have occurred during the past several weeks before the actual event takes place. In any good full-scale functional exercise, inclusion of emergency communication systems, operational center management, public safety, security response, urban search and rescue, and fatality management are all good groups and organizations that should be considered regarding planning and development. In order to commence the full-scale exercise, a general understanding needs to initially take place regarding the initial notification, when the event is going to take place, and how the ongoing operations of the incident will be performed one more time before the actual full-scale exercise. A good example of being able to research, the background is dealing with the types of statistics in regards to an active threat or active shooter within the hospital setting. You may also wish to include the type of profile, the type of active threat, the type of weapons that may be used, and the types of locations that may be impacted in this event. Once there is an understanding regarding the need to perform a full-scale exercise, then a step-by-step process must be followed in order to outline what is going to be needed, what's going to be developed, and how to create an effective program regarding it. For example, the needs of the healthcare organization. It may be self-evident that there will be a needs assessment to be conducted in order to identify the plans, procedures, or the operations that will be involved in such a program. Full-scale exercises must take into account that hospitals and other organizations, of course, build upon certain areas they feel where there is a need for training and education to encompass their personnel. A full-scale exercise does take time to organize and does take much planning throughout the course of a year. And once all these areas have been met, it is imperative to the successful operations based on this type of event, whatever it may be, human-made or natural, that a full-scale exercise is implemented for the community.